Welcome to the program. I'm your host, Neil Howard. Thank you so much for returning for another segment of Health Professional Radio. In this segment, we're going to be speaking with Dr. Allison McMullen. She's joining us here as scientific partner for Molecular Diagnostics at Roche Diagnostics to talk about a survey that shows that many Americans are confused by the differences between PCR tests and rapid antigen tests and when to use them. Welcome to Health Professional Radio. Dr. Allison McMullen, thank you for taking the time.
Thank you for having me.
Aside from your position there at Roche, give us a brief look into your professional background, and let's talk about this confusion.
Yes, for sure. So a little bit about myself. So I currently work for Roche Diagnostics, and we are a laboratory diagnostic company. We make tests, many of which now people are very familiar with, tests for COVID-19, flu, RSV. And we're a pretty large company. Last year, 27 billion of our lab tests were used worldwide. But before joining Roche, I actually worked in the laboratory. I was a laboratory director at an academic hospital in Augusta, Georgia. So I was on the front lines helping the labs do COVID testing amongst many other testing diseases and got to switch over. And now at Roche, I get to use all of my experience, my knowledge, everything that I've learned, and help inform Roche when they're developing tests or helping sell the tests, but I also help educate our customers and others on how best to use these tests and what they may mean. It's kind of cool because now with COVID, people actually understand a little bit of what I do. Before, it was always like talking to a blank wall and no one understood, but it's nice. People understand a little bit more about diagnostics.
When it comes to this so-called tripledemic that we find ourselves experiencing, where is the confusion coming from? Is it coming from how to properly acquire and use tests? Is it coming from not knowing the differences between the different respiratory illnesses? Or is it just mass confusion about all of it?
I think it's a little bit of all of those. I think there's a lot of confusion because now with COVID, we're having multiple viruses that have similar symptoms circulating at once. So COVID, RSV, and flu all have very similar symptoms. And so in addition to other respiratory viruses that exist at the same time, so people don't really know what they have anymore. It's not just so easy to say I have the flu or I have the cold. There's a lot of things circulating at one time, and that's really what's making that tripledemic, as it's been called now. Seeing all three of these causing severe disease at the same time. And so it makes it really important to get tested. Now we have at least two different diseases, flu and COVID, that have therapeutics or treat medication that can be used to treat them, to shorten, to improve patient outcomes, so to make the people get hopefully healthier faster. And so to get the right treatment, we have to have the right diagnostic test. And I think that's where some of the confusion comes in, understanding what is the right test. And we know that with a survey that we had, 2 out of 3 Americans are actually confused about these different tests. They don't understand necessarily what is PCR or polymerase chain reaction and what are rapid antigen tests. We hear about them in the media, but how are they different? And this may differ kind of depending on who we ask. Parents, I think, have a little bit more background, knowing that PCR is more accurate. It actually allows us to get a quicker and more accurate, earlier in the time course, and more accurate results so that you can get the better treatment. Antigen tests are good, but they're not as accurate. They're faster, and we know we can have them at home, but they just aren't quite as good as a PCR test.
Is accuracy the main difference between these two types of tests?
It is. Accuracy is maybe at different times. So PCR, will detect virus earlier. So maybe within the first couple of days when you start to not feel well, when the treatment really is important, you will get a quicker result or an earlier result with PCR, whereas antigen may not become positive until a little bit later into the symptom course. So maybe day 3, 4, or 5, you might start to see those antigen tests become positive. So that's kind of the difference there is when they can detect it in the course of the disease.
Did the study reveal some of the reasons for the confusion or lack of information? Did some of the respondents say that I just didn't know where to find information, or the packaging wasn't clear? Were there any indicators as to what was causing this confusion and how it might be addressed, especially there at Roche?
Yeah, I think there is confusion. You know, we hear a lot about the different tests in the media, and I think what exactly they are may not be portrayed well in some of the media, so that may lead to some of the confusion. There's definitely not, I think some of this is education. We need to continue to provide that education as to when each type of test is appropriate and what value they may bring. Understanding how the tests work and what the shortcomings may be, the weaknesses of the test, is really important to understand what the results may mean. And so I think that's where education comes. And that's one of the things we try to do at Roche is provide education. We provide it to clinicians, we provide it to laboratorians, and then we hope, that goes down to the patients and so that they understand what's actually, what they're trying to achieve when they're trying to get tested.
What are some of the latest advances in diagnostics from Roche, and how do you think that they'll impact public health overall?
Roche is constantly trying to expand their diagnostics and where we can go. And how we can, I'm going to start that one over.
No problem.
Sorry. Roche is always trying to be an innovator, and they want to be on the forefront. We were the first diagnostic company to have COVID-19 tests approved by the FDA back in March of 2020. And I think we want to continue to lead in that direction as we move forward. We're always looking at what's coming next or what's here and how can we better diagnose it and make it easier for our laboratorians, our healthcare providers, and our patients to get the test they need when they need it and where they need it. And it's something we're always trying to look at as we move forward.
Is there anything that you'd like to add for our listeners? And then if there are any websites that you'd like to give us where we can learn more, just feel free.
Yeah, the CDC is a wealth of information. If you go and just Google CDC flu or CDC COVID-19, you'll find so many resources there, both aimed at a patient level and also at healthcare providers. And it's always being kept up to date as to what's the latest trends for the diseases, how best to get tested, what you can do once you're sick. Lots of great resources there. I think my final thoughts, are we're not getting rid of respiratory infections, COVID-19, flu, RSV. They're all here. We're going to have them in our lives at some potentially unpredictable seasons as we move forward. So I think first thing is getting vaccinated against flu and COVID. That helps prevent getting sick or lessening the severity if you do get sick. And then once you get sick, finding out if you need to be tested and getting the right test so you can get the right treatment at the right time. That's really what will help get you better or help prevent you from spreading it to others.
Well, it's been a pleasure speaking with you this morning, Doctor. Thank you so much for lending us some of your time.
Thank you very much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Allison McMullen. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.